Now, a newer treatment is what we call ketamine infusions or ketamine treatment. Ketamine is actually a hallucinogenic drug that years ago was a club drug known as Special K. Well, it turns out that there are properties of ketamine that can actually be very useful in treating depression. What ketamine tends to do is it promotes synaptic connections within the brain for learning and memory, and it can block other receptors that can lead to rapid antidepressant action. So what it is you're administered an IV for about 40 minutes. The dose is often determined by your weight. You're totally awake. During an infusion, some people will sometimes have odd perceptions, dissociative experiences that will go away once the infusion ends. It's about 6 infusions over 2 to 4 weeks. The first one is the most intense, but after about 30 to 45 minutes after getting an infusion, you can leave the office and be fine. Studies show that it will reduce or eliminate very acute or distressing symptoms of depression, including suicidal thoughts. It can actually induce neurogeneration, or actually creation of nerve cells in the brain, particularly in the hippocampus, which is a part of the brain responsible for memory. There are some side effects. Some people complain of nausea, drowsiness, feeling strange. They tend to go away quickly, which is why typically doctors will want you to stay in the office for at least 30 minutes to an hour after an infusion. However, ketamine, even though it can be very effective, it's not always covered by insurance, and it can cost about $300 to $800 per treatment. But studies are finding it very promising. 60% or more find relief from depressive symptoms. The relief can be relatively short-acting, within 1 to 3 weeks, which is shorter than what you might see with most antidepressants. And it's often reserved for severe cases of treatment-resistant depression. This is not for someone who has a mild case of depression. Again, when other antidepressant medications have failed, if there's acute suicidality, this is what ketamine infusions have been reserved for.